The Biden administration is expected to announce a booster shot for all Americans, and this is 8 months after their last COVID vaccine. But local experts say, maybe this shouldn't be the focus. So let's bring in Dr. Paul Offit, the director of the Vaccine Education Center and professor of pediatrics in the Division of Infectious Diseases at CHOP. Good morning to you.
Good morning.
We appreciate you being here as we try to sort this all out as we expect that news of that recommendation for a booster shot. First, I want to talk about how we got here. Are they saying we need this booster shot because of the Delta variant and the surge that we're seeing with that, or because the vaccines that many people have had, they're losing their efficacy?
Well, both. I mean, I think the goal of this vaccine is to prevent serious disease, meaning the kind of disease that causes you to go to the hospital or go to the intensive care unit or die. So the question is immunity against severe disease provided by these vaccines fading? Now, the CDC presented data last Friday showing that it wasn't, that protection against serious disease remained excellent, including against the Delta variant. And not only in this country, but in other countries like England, Canada, and even Israel. So the question, and yesterday morning, one of the CDC folks was asked, is there any evidence of a need for a third dose? In other words, is protection against serious disease fading? And she said no. So nonetheless, yesterday the administration made a recommendation that they were about to say that everyone should get a third dose, assuming they've gotten the first 2 doses of mRNA vaccines, and that today we will learn about what those data are. But those data would have to be in direct contradiction to everything we've seen so far, which is surprising. So we'll wait. We'll wait to see what data they show, but I just am skeptical.
And how does that happen, though? How do you have information that's so different?
I think you don't.
Okay.
If I had to make a guess as to what we're going to see today, it's going to be not much different than anything we've seen over the last few days. And so therefore, I'm not sure why this recommendation is being made. I don't know. Let's see what data they have. But again, it frankly doesn't make sense on its face.
And would this even, what's in it? Is it exactly the same shot that folks have been taking over the past year? And should we just call it, a supplemental shot, or is it really a booster?
Again, it's probably the better way to think about it would be that it would be sort of a continuation of the primary series. So like, say, the hepatitis B vaccine is a 3-dose vaccine. So this would be a 3-dose vaccine. And maybe the J&J vaccine would end up being a 2-dose vaccine. But again, there should be far more compelling evidence than the evidence that we have that we need this. It's a little frustrating, actually. What's also frustrating is that really the data should precede the recommendation. In other words, we should have seen the data on which a recommendation was based rather than hearing that there's going to be a recommendation and then seeing the data. It's kind of a backwards way of doing it.
Right. Do you think it's because of all the talk about what they're calling breakthrough cases? And I know you're not a fan of that term, breakthrough. Explain.
No, I'm a fan of the term breakthrough if we define it correctly, which is to say that despite being vaccinated, nonetheless, you are hospitalized or in the intensive care unit. That's a breakthrough case. I mean, to call an asymptomatic infection or a mildly symptomatic a breakthrough case is to set an unrealistic expectation of this vaccine and most vaccines. I mean, most vaccines prevent, moderate to severe to critical disease. That's true of this vaccine as well. But you're asking way too much of these vaccines to prevent asymptomatic infection or mildly symptomatic infection. Actually, Lindsey Graham got this right. When he's fully vaccinated, was exposed to COVID, he had a mild upper respiratory tract infection associated with sinusitis, and he said correctly, it would have been much worse if I hadn't been vaccinated. That's right. That's the way to think about this. Okay.
Well, we've been talking all about this for regular vaccinated folks. What about for the people who are immunocompromised? Do you still have the same stance for those folks?
No. I think people who are immune compromised, and this may include also people in nursing homes who are, by definition, much older and have comorbidities. They're a third dose for people who've had somewhat of a response to the first 2 doses, but not an adequate response. Their third dose may make a difference. No, that's different. I think we should follow what's been done in other countries and consider a third dose for certain groups of immune compromised people. But that's different than making that kind of recommendation for the general population.
For sure. I just wanted to make sure that we had those 2 separate recommendations there. But I guess for everybody else, you'd rather us just wait and see, wait till we have the data, and probably talk to your primary care doctor to get their opinion as well?
Right. Well, I think that hopefully that will be very clear at the federal level, the national level, that this is what the recommendation is. So you don't have to depend really on your individual doctor unless it's an issue of whether you're immune compromised or not. But hopefully today things will clear up. But don't quite understand how it is that someone from the CDC on Friday and someone from the CDC yesterday basically said we don't need a third dose, and then we hear from the administration that they're recommending a third dose. It's just not understandable to me.
Yeah, that is interesting. So hopefully we'll learn a little more. Well, before I let you go, the other thing that everyone's also talking about, I'm sure you've heard of different school districts across the area. They're coming up with their own stance on whether children should be masked or not. And even in Bucks County, we've seen reversals where at first they're saying, oh, masks optional. Oh, no, wait, everyone should have their mask. As someone who works in pediatrics, what is your official recommendation? Do you think that students should have masks on when they go to school in just a few weeks?
Yes, you have a combination of several events which are worrisome. You have the Delta variant, which is clearly more contagious. You have an increase in dramatic increase, actually, in the number of children now that are being infected. Children less than 12 years of age can't get a vaccine. The only chance they have of fighting this infection is to wear a mask. Children between 12 and 17 years of age can get a vaccine, but most don't. Only about 30 to 35% of that population is vaccinated. So, yes, wear a mask. I certainly at the beginning wear a mask, and then see how it plays out in the community. But if you're in a community that has, say, greater than 100 cases per 100,000, which is true often in many of these communities in the Southeast, it makes sense to have a mask mandate. And frankly, I think teachers should have a vaccine mandate. There's no good reason not to get a vaccine if you're in an age that can get it. There's a lot of bad reasons, but really no good reason.
But don't you think, as some are saying, the news about saying, okay, now you're going to need a booster and all this other stuff, that's hurting folks from wanting to get the vaccine because they're just thinking, oh my gosh, we're going to have to get this all the time to keep it up.
I think it's been confusing. I think the other thing that was confusing was the misstatement, frankly, that whether you're vaccinated or not, that when you have an asymptomatic or mildly symptomatic infection, that you still shed as much virus, that you're as contagious whether you've been vaccinated or not. That was wrong. I mean, that was just a wrong statement based on a number of studies, one most recently from Singapore, that showed that was wrong. But people listened to that and they thought, well, it doesn't matter whether I get a vaccine. I'm still equally contagious, so what's the point? So again, I think the messaging has been confusing, and I'm sure that has hurt vaccine uptake. But, you know, there's one way out of this pandemic, and that's to vaccinate. We only had about 50% of this country that's vaccinated, and then you have probably another 100 million people who've been naturally infected, which I think does offer at some level protection. But we probably need to vaccinate another 80 million people to get a level of herd immunity that will significantly slow the spread of this virus. So we're not close yet.
Well, Dr. Offit, we definitely appreciate your opinions and your insight. So I guess we'll need to talk to you after we hear from the CDC and hear about this data, because I would like to hear if you have a turnaround or if you still feel the same once we learn more.
Sounds good.
Okay, thank you.